Good evening, and welcome to the Chicago Chapter National Black Nurses Association Health is Wealth. I'm Reverend Evelyn Collier-Dixon. I'm your host for today, and we have Miss Janice Henry, who is our coordinator, as well as our telephone operator. With us today, we're just so happy. Let me just say, first of all, that the Chicago Chapter National Black Nurses Association is a culturally competent nursing organization consisting of registered nurses, licensed practical nurses, and we have student nurses. And Miss Ellen Durant is our president. And we're just so happy to have in studio with us today two people that I love so dearly because they're the ones with the wealth of information, and I kind of piggyback on them and make it seem like I know what I'm talking about. Okay, so we're going to get through this program today because we have Dr. Mildred Taylor, and she's a nurse. Has a doctorate in nurse practice, and she is a registered nurse. She has participated in two Nurse Practice Acts, Sunset, the 2007 and the 2017. So she's been around for a minute. The first Nurse Practice Sunset, she was on scope with the Practice Committee, and the second Nurse Practice Act, she was not assigned to a group. Dr. Taylor is presently and currently the chairperson of the Chicago Chapter National Black Nurses Association Health Policy Committee, and it's just an honor. She's the one to my far right, okay? And in the middle we have Pam Robinson, and she is a master prepared nurse, MSN, registered nurse, and she has participated in the 2007 Nurse Practice Act and as chairperson of the Scope of Practice Committee. Pam is a member of the Chicago Chapter National Black Nurses Association also, and she sits on the Health Policy Committee. And I'm just so honored to have these two young ladies because they're the ones that keep us informed with all the nursing legislation, and that's what we need. We need to know what's going on as it relates to our practice. Both of these nurses will be sharing information with us today, and they're going to be talking about the public. They're going to be talking with you, the public, on Senate Bill 2151 and House Bill 2604, and they will tell you in detail what that all entails. And Senate Bill 2151 is about the Nurse Practice Act amendment that will make the Nurse Practice Act safe for the public, and that's truly what we want. We want to be safe consumers, okay? And House Bill 2604 is about safe staffing in Illinois. And you know, that has been an issue with staffing in our acute settings and our long-term settings. Staffing has been a problem. So we're going to talk to the experts on these bills today. So I don't know who's going to start. Pam, you're going to start first. Yes. So let us hear what you have to say about these bills or anything in particular to the practice of our Nurse Practice Act. So just start off.
Thank you, Ellen. I appreciate the opportunity to speak to the public regarding the Illinois Nurse Practice Act. It has been around for 100 years. Nurses are licensed and educated to be able to be allowed to practice, and there have been some changes in that 2017 Nurse Practice Act. Our bill sponsor of Senate Bill 2151 is Senator Michael Hastings, and just to let you know, House Bill 2604 sponsor is Representative Crespo. So these are sister bills. The Nurse Practice Act determines what one must have to be able to practice nursing, and the House bill for the RN staffing ratio is how many nurses that you need when they are in the acute care setting in a hospital.
Okay.
So the first place that our bill will need to get out of will be the Senate Licensed Activities Committee. If anyone has any of these legislators, please, anyone can call the Senate committee when the bill is coming up. Emil Jones, Jennifer Bertino-Tarrant, Omar Aquino, Christopher Belt, Rachel Crow, Robert Martwick, Neil Anderson, Dale Fowler, and Chuck Weaver.
And all of these are state senators,
Correct.
right?
Correct. Illinois state senators, and that's where our bill, hopefully it will keep the same bill number Senate Bill 2151. If it doesn't, we will make sure the public knows if that switches. Bill probably will be presented by our sponsor around March, and the legislative session will go from when it opens in near close to the end of January to May. So we'll have that time to be able to make sure our legislators are aware. As soon as it gets out of the Senate, it will go to the entire chamber of the Senate. We'll have to win by 51%, and if it wins by 51%, it will go over to the House, remaining the same bill that it passed out of the Senate to start all over again in the same type of committee in the House and get out of the committee and have to go to the entire chamber. So our work to get it out of the Senate is just the beginning, but getting people aware of why we want to do this, I think, is key.
Okay, let me interrupt you. Talk to you for a minute. You said get into people. How did we get here in the first place?
Well, every 10 years, the Nurse Practice Act sunsets. We review it to decide if it's current, out of date, new things have happened in the practice. Does it promote, does it protect the public? Because the purpose of the Illinois Nurse Practice Act is very clear, that the practice of professional and practical nursing in the state of Illinois is hereby declared to affect the public's health, safety, and welfare, and to be subject to regulation, which is law, and controlled in the public's interest. It is further declared to be a matter of public interest and concern that the practice of nursing, as defined in this act, merit and receive the confidence of the public, and that only qualified, authorized, be so to practice in the state of Illinois. And that's where we have a little bit of a problem with the new language. Qualified equates to educated, and authorized equates to being licensed. In the state of Illinois, when a nurse decides to go into school to be a nurse, they're vetted before they even go into the program to make sure they have the skills and the abilities and the knowledge to be able to pass. They have to pass an approved state program by the Board of Nursing, and they have to pass with a B average. After they have that, they have to take a leveling exam. It's the National Council Licensure Examination, otherwise known as NCLEX. It's a standardized test that every state in the United States is regulated by the State Board of Nursing to determine if a nurse candidate is ready to become licensed as a level entry nurse. There have been some major changes, and as Mildred and I were co-authors of the 2007 Nurse Practice Act, we built a very robust definition of registered professional nurse, which included the foundation of nursing, which is the nursing process. Also, there were definitions of work to be assigned or delegated to other people that nurses work with. Now, the robust definition was watered down. It removed nursing process, it removed the role of the nurse in medication administration, and these changes, along with removing the definition of task, which was a definition of work nurses would delegate to unlicensed persons, did not require nursing knowledge. And they took the word nursing activity and replaced it with nursing intervention. There is now only one definition within the Nurse Practice Act, and it contains the nursing knowledge and clinical judgment of a nurse. Now, our problem with that is Chicago Chapter National Black Nurse Association, and also supported by the Illinois Nurses Association, National Nurses United, the Illinois Federation of Teachers, because they have school nurses underneath their membership, and the Illinois AFL-CIO all support Senate Bill 2151 to be amended to restore the public safety, which is mentioned and mandated in the legislative purpose. So, with the new language of nursing intervention, a nurse can assign a nursing intervention now in the community setting, which is outside the walls of the hospital, schools and clinics, and delegate that to a person that is unlicensed. So, including medication administration. We have grave issues with that. There is nowhere that I know that we've, as a state of nursing community, decided that medication administration is not and remains a complex task, not a task. It's a responsibility.
Yes.
Nurses have so many things that they have to learn before they're able to administer medications in the clinic setting as they're going to school and are tested under that wonderful NCLEX.
Okay.
But as they go through all of their coursework, they are proficiency out with clinical competencies and clinical theory to measure how much they actually know. So when a nurse now is going to delegate medication administration to an unlicensed assisted person, how are we making sure that that's safe?
You're not. You
So
can't.
those are the things that really, if you want to drill down, in the definition of nursing intervention, means any treatment based on clinical nursing judgment or knowledge that a nurse performs. Individual or entity shall not mandate that registered or professional nurse to delegate a nursing intervention if the registered nurse determines it is inappropriate to do so. The danger has happened now with the passage of this law. Work environments in the clinics and in the schools now allow a nurse to delegate nursing interventions. Not just medication administration, could be dressing changes, could be whatever that is needed, and to delegate to this unlicensed assisted person. Removing such detailed language in the definition of the professional nurse began the uncoupling of education and licensure to delegating to others as they removed the definition of task, which was very clear. So a nurse could make a quick, clean delegation and have it be safe.
Let me stop you for a minute, Pam. I remember, and this is one of the things I do remember, is I thought it initially started off being a pilot type of thing. When did it get into law? Can you explain that to our audience?
Well, I think I'm going to let Dr. Taylor speak
Okay,
about that because
okay.
you're absolutely right regarding a licensed medication aid pilot that
Right.
started in 2014.
Okay.
Hi, yes, I will talk about that. And there's no evidence right now as to the safety of the pilot or these medications, I should say MAs or unlicensed, non-nurses people that are doing nursing interventions. There's no evidence that shows that they are safe. In 2017, the Nurse Practice Act regarding to make us the evidence, we often, like I said, where's the evidence to make such a dangerous change like they did in 2017 regarding delegation of medication administration to unlicensed people? There is none evidence because this pilot that we all are talking about was unsuccessful.
Okay. Okay.
Recently, the Department of Professional Regulation put out a letter explaining that.
Okay.
I think everybody received that letter, but it was written in such a broad term, it's, loosely
Okay.
or broadly. When questioned about it, the department said basically they were only supposed to write about certain things in the law. So they responded with the information in the law that was a summary, that there was no errors in the law, and it was only like 4 participants in 3 years.
4 participants in the pilot?
Yes.
Oh, wow.
So there was not enough information or data to conclude whether it was safe or not.
Right.
Basically, it was unsuccessful and it failed
Okay.
because it was only 4 people.
Right.
So
okay.
what you're going to get from 4, you're going to change the license of all the nurses in the state of Illinois on 4 people based on information from 4 people?
Right. Let me just say to our viewer and audience, we just certainly have a call in 312-738-1060 if you have questions. I would like to ask you, if you're laying in the bed or at home, who would you want to administer your medication? Would you like for it to be someone who's qualified and who's certified to give that medication, or someone who's had sounds like no training, but for people participating in this pilot study. And from what I understand, it was in a long-term setting, right? So how can you safely administer medication if you're not trained and are certified to do so? So, okay, thank you for sharing that. Anything else you ladies want to share with us regarding
Well-
these bills and how we need, because this time goes by so
Yes, I
fast.
know.
And I want you to be able to introduce your bills and tell us what we need to do to call in, who we need to call in to. So I'm going to turn it back over to either one of you.
Okay, for one thing, this whole idea of changing our Nurse Practice Act was done on the basis that we had a nursing shortage.
Yeah.
We do not have a nursing shortage. That was data that was delivered from the Illinois Department of Public
But they've been
Regulation
saying that,
as
Mildred,
well.
for years. They've
that
been saying
we
that for years,
do
but
not
it's really
have-
not a nursing shortage.
It's not. They laying off nurses
I
in
know.
certain places. So how can that be a nursing shortage?
Right, right.
And they're being replaced by MAs, medical assistants. So in the future, we may have adequate numbers of nurses just not able to find a work. If we continue to replace them with MAs that does not have a license to even pass medication or make assessments, but you just probably need, what, a few nurses around? And they probably don't even know these people, their skill set. So they have to just be around the scenes.
Right. I'm going to get back to Mildred, but I want to ask you, I'm going to get back to Pam, but I want to ask you, have you talked to any nurses who have voiced their opinion about how they're not, comfortable with this? What's the feedback?
We have been having stories from nurses from across the state, especially those that are working in clinics. They have found that they're replacing RNs with medical assistants. Medical assistants, again, have no standardized education, they have no licensure, and there is no state agency oversight, as nurses are qualified to have all of those things. So this is important to understand, that who is taking care of you when you go to the clinic? Who's taking care of your children when they're in the school system? Chicago Public Schools were on strike. One of the tenets of their contract was they wanted a school nurse and a social worker in every school. This is the research that we have continually found. There is nothing that says that unlicensed persons are equal to or safer than licensed nurses to administer medications. The remedy in Senate Bill 2151 is to restore the robust definition of registered professional nursing, which includes the roles of medication administration, education, and of course our nursing process, which is the foundation for nursing education. Restores that only educated licensed nurses practice nursing, because we have unlicensed non-nurses practicing nurses, because no one has said to us in any type of evidence that unlicensed persons understand the ability to administer medications. And restore the definitions such as task that will help clarify and make the Nurse Practice Act less confusing to identify what work should be delegated to unlicensed assisted persons. And we don't delegate nursing RN to nursing RN. We make an assignment. We delegate nurses, licensed practical nurses, that work is delegated. But we have to be very clear. In the Nurse Practice Act, nurses need to know their boundaries of their scope.
Okay.
The employer needs to know the boundaries. Lawyers want to know the boundaries. If a nurse is going to be held accountable to her actions, if there's any infraction, they're reported to the Board of Nursing. That is where the nurse's license will be viewed for any type of infraction or possibly revocation, losing your nursing license. In these situations, the nurse is accountable for all delegated work. So if the unlicensed person makes an error, that will fall back on the registered nurse. So the idea that a nurse doesn't have to delegate, when they are setting up nursing work environments that have replaced nurses with unlicensed assisted persons, the nurse has a choice. Do I stay and take care of these patients, or do I have to go? So the thing is, ask who's taking care of you when you go to the clinic. Make sure that your children are taken care of, licensed persons. And in a clinic, in a rural area, Manhattan, Illinois, one of the nurses got a phone call from one of the medical assistants. Now, it says in the new language you can delegate topicals, stuff medicine that goes in the top of your skin, or pills. This medical assistant was delegated the task, which again medication administration is not, to give an injection. Trying to get the the vial had powder in it. And the medical assistant called the nurse at home and asked, how do I get the powder out of this vial? Medication administration is taught in schools of nursing, proper preparation and administration of medications, plus the responsibility of the nurse to do teaching around the medications.
Exactly.
Medication is a very large piece
Very
of a
large
patient's
piece.
treatment.
We got the 5-minute sign, but I want you to again tell us what you want the public to do and to what you want them to do as it relates to these bills and how critically important it is that they react.
Our remedy is to pass Senate Bill 2151. And we need the community, the public, the nurses, everybody to get involved with this unsafe activity that's going on in our state. And it's some steps we must do in order to get there.
Okay, you want to tell us?
Okay. And also, we have a lot of information. So anything you didn't understand tonight, you can go on the website, on Chicago Chapter website, and we have all the bills, all the fact sheets on the website that you can read.
Okay.
And that is Chicago Chapter, BNA.org. Or just Google Chicago Chapter National Black Nurse Association will take you right to the website.
Okay.
And if you are unsure of who your legislator in the state of Illinois is, I want you to go to www.illinoispolicy.org/maps/ or just Google who's my Illinois state representative. Start with the senators because we need to get this bill. Look for licensed activities Senate committee and call them up. Anyone can call up these committees and then locate who your state legislator is. Start with your senators and go to your House representatives.
You can also go to the village hall or city hall and call and ask them who your representatives are.
Okay.
For people that is not handy on the computer,
Yes.
you can do that on the phone and ask somebody.
Look in the back of your voter's registration. There's the district that you vote in.
Okay.
So there's different ways the city clerk to be able to call them up and find out exactly you're registered as a voter, registered to vote for sure. But make sure that you understand who your state, Illinois, Senator and House of Representatives is, and ask them to vote yes on Senate Bill 2151.
Okay. Okay.
And
so-
co-sponsor if possible.
Absolutely, co-sponsor the bill.
co-sponsor the bill,
Yes,
okay.
your family deserves to be safe.
Exactly, and we agree 100%. And with the remainder of the time that we have, I just want to say that Mildred or Pam, it doesn't matter, the safe staffing, can you just revisit that for a minute or?
Sure. House Bill 2604 is being sponsored by Representative Fred Crespo. It mirrors the California racial law that happened and was passed almost over 15 years ago. Very specific as to how many nurses have to be on med-surg, labor and delivery, intensive care, the pediatrics, it's all broken out because more nurses is it safer for patient outcome. Less falls, less infections. One of the things it also does is save money.
Yeah.
When you have more nurses, you have shorter lengths of stay. Nurses are the ones that coordinate the care. And when you move a nurse farther away from the patient's bedside, bad things happen.
Yes.
Cases of that have been through federal research show that failure to rescue, you have an opportunity to be safe in the hospital. If a nurse can't get to you, she can't save your life.
Exactly. So that's like staffing by acuity.
Yes.
Is that
It's
what it is?
staffing by
Yes.
ratios
By
and
ratio
acuity.
and
yes.
acuity. Okay.
Yes.
Thank you,
As
ladies.
an INA bill.
Right.
And
Thank you,
yes.
ladies, so much for coming on. I know we didn't have a caller, but you can always visit us on YouTube. Pull us up and watch. And if you have questions, you can call us at 773-792-7222. That's the Chicago Chapter National Black Nurses Association. Again, we want to invite you to our National Black Nurses Day, which is going to be held on the last Friday of this month. And it's going to be at Apostolic Church. More information, I'm sure, will be shared there. It's the big celebration. They're going to be celebrating legendary nurses as well as nurses who are working in midwifery.
And we have a lobby day March 4th then in Springfield.
Lobby
If
day
you're
in
interested, go to our
Springfield.
website, Chicago
Exactly.
Chapter.
We would be glad to have you. So we want to thank Pam and Mildred Dr. Taylor and Pam for sharing with us this wealth of information. They couldn't get it all in because we had such a short time, but we thank them for the time that we have, and we want to say thank you and have an
you.
awesome
Thank you.
evening. Good evening.
Good evening.
Bye.